Good evening, friends, families, and distinguished guests. My name is Dr. Tanya Mansell. I am the Executive Director of the Associate Degree Nursing Program. I welcome all of you to this evening's San Antonio College Department of Nursing Education Summer 2024 Completion Ceremony. Tonight is our first completion ceremony that will recognize the Associate of Applied Science and the third graduating class from our Bachelor of Science Nursing Bridge program. The graduates that we will be celebrating this evening have dedicated many hours of study to accumulate with tonight's ceremony. The faculty and staff of the Department of Nursing Education would like to thank each of you for being present this evening. Please stand to welcome the 2024 summer graduates and remain standing for the presentation of colors presented tonight by Burbank High School JROTC and for the national anthem.
Our presentation of colors tonight are from the Burbank High School JROTC.
Oh, say, can you see by the dawn's early light what so proudly we held at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming. And the rugged red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Please be seated. I call back to the podium our Executive Director of the ADN program, Dr. Tanya Monsell.
At this time, I would like to introduce our interim president for San Antonio College and one of our biggest supporters for the nursing program, Dr. Francisco Solis.
Thank you, Dr. Mansell. Good evening. First, if we could have the graduates please stand. Family, please help me welcome our graduates this evening. Now, just a moment, family, if you'd please stand. Graduates, please extend a big thank you to all of your family who's here this evening. I'm sure without them, you would not be here today. Thank you. Please be seated. At this time, too, if you'd help me welcome members of the Presidential Cabinet, Dr. Cassandra Ricones, Vice President of Academic Success, and Rosalind Ong, Dean. Thank you. Again, good evening. I'm Dr. Francisco Solis, and I'm serving as interim president of San Antonio College. And I, too, am a proud graduate of San Antonio College. I'm very happy to be part of the Summer 2024 Nursing Pinning Ceremony here at the Summit Christian Church. I'd like to take a moment to recognize, right, as we've done, all of our graduates and our family members. Tonight's ceremony is a part of a distinguished tradition that connects our students to nurses going back several generations. This ceremony began more than 150 years ago when Queen Victoria of England awarded a medal to Florence Nightingale for her remarkable service to the nursing profession. Since then, the pinning ceremony has become an important milestone for students entering into the nursing profession. San Antonio College's nursing program has also a long and distinguished history. It's the oldest program in San Antonio and goes back more than 50 years now, and it's one of the largest programs in Texas. And at the Alamo Colleges, we're all extremely proud of our nurses and our nursing program. Our students are well prepared for entering a demanding career field. For example, after taking the Texas Board of Nursing licensing exam, our graduates have an almost 90% pass rate. And job placement rate. With this pinning ceremony, we hold up the amazing accomplishment of our students graduating from our nursing program. We are very grateful for you and all of the work you've done to add to this vital career. We also want to recognize the help and support of your family and friends here tonight. And most importantly, take pride in your amazing achievement as you receive your pins tonight. Realize that you are now and forevermore part of a distinguished nursing tradition. Thank you very much, and again, congratulations from all of us at SAC, and continue to make us SAC proud.
The graduating class of August 2024 have invited Mrs. Bonnie Blanchard, MSN RN CSPC, as their keynote speaker. Bonnie Blanchard is currently serving as the Regional Director of the Primary Stroke Program for the Baptist Health System. She began her career as a licensed vocational nurse, continued her education, earning her RN. She is an alumni of San Antonio College. She has practiced in long-term acute care, skilled nursing, and intensive care. Bonnie has made significant contributions to stroke research, including a published study in the Journal of Neurointerventional Surgery titled Paramedic Utilization of Vision, Aphasia, Neglect, VAN for short, Stroke Severity Scale in the Pre-Hospital Setting Predicts Emergent Large Vessel Occlusion Stroke. Additionally, she has published abstracts with the American Heart Association, the American Stroke Association. Please join me in giving a warm welcome to Mrs. Bonnie Blanchard.
Good evening, students, faculty, family, and friends. I'd like to start by saying thank you to the faculty for your dedication and education to nursing by preparing these students to embark on their journey in the nursing career field. Tonight, we celebrate the achievements of each student sitting here preparing to venture into healthcare as registered nurses. Students, enjoy tonight and celebrate all that you have accomplished to get to where you are today. You have taken numerous quizzes, tests, completed projects, and learned at a multitude of clinical sites. Many of you have probably faced challenges personally, professionally, or collegially. Personally, I hope you remember all the hours and sacrifice it took for you to get where you are today. Professionally, I challenge you to hold steadfast in your career and treat every day, every situation as new to ensure the care you provide does not waver. Collegially, I urge you to always remember what it was like to be a novice nurse, unsure and with more to learn. So you treat incoming novice nurse with compassion and provide them with the knowledge to be successful in their nursing journey. As you prepare for your NCLEX exam, remember what you have learned and the experiences you have gone through, the determination and will to complete your studies, so that you walk on the testing site confidently and believe you will succeed. Once you attain your license and start working, provide your patients with skillful care, empathy, and compassion, and remember it is the day-to-day interactions that truly define the heart of nursing. Tonight, I encourage you to commit the following 3 B's to memory. Be present. Be present when you are at work, whether it is your first week during orientation, going through Skills Lab, or when you are on your own and accepting an assignment. Maintain focus and be engaged during interactions with fellow coworkers, your patients, or family members. You never know when a vital piece of information may slip by because you have a million things you need to get started on and your mind wandered off. Stay sharp and attentive in the moment and don't allow outside distractions to keep you from performing at your very best. A nursing assessment is important to establish a baseline, early detection of change in condition, and providing patient-centered care. I also encourage you to hold others to being present and provide you with a detailed report of a situation. So many details get lost during handoff, and minimizing a patient's condition or situation may have a disastrous impact. Be active. Be active in your patient's care. Ask questions, use critical thinking, and be an advocate. A question you may find yourself asking a lot at first is why? Why do we do things in a certain way? Why do we use one therapy over another? As you become more active in the nursing profession, you will start to find the answers to your questions. Seek out opportunities to be active. You may want to better understand a policy or protocol. Ask to be a member of the team that reviews them. Read journal articles on topics that interest you, or look for research opportunities and share your newfound knowledge with others. There are different nursing organizations you can join at the state, national, and international level. Ask to join in on projects or committees where you work and be a part of process improvement. Work towards earning a national certification and become an expert in the field you work in. One of the remarkable things about nursing is how diverse it is and the many opportunities you will have to explore what interests you most. Be active in your community. There are huge knowledge gaps in the San Antonio area, from blood pressure and diabetes management to hands-only CPR and stop the bleed. No one is too young or too old to learn. I have worked with stroke patients for roughly 5 years. And one case that always sticks out is an 8-year-old who noticed that his grandma wasn't feeling quite right, didn't look quite right. So he called 911 and he told EMS what he saw, and she was able to get the care that she needed. Be educated and be an educator. Keep learning. Stay educated. There is always more for us all to learn. When the time is right, go on to earn your bachelor's, for those of you with your associates, and gain further insight into the hows and whys of our profession. There are so many advances in medicine and new information from studies and evidence-based practice. Be educated about your own practice. Reflect on the care and give and determine if there are things that you would change. Be an educator. When you move from being a novice to an experienced nurse, educate the novice nurses and break the pattern of nurses eating their young. Take pride in the knowledge you hold and be willing to share it with others. You never know what life you may save from what you taught someone else. Be a patient and family educator, and remember, care doesn't stop when they leave the hospital, a clinic, or a school. Preventative medicine and managed care are equally as important as care in the moment. So whether it is a month, a year, or 10 years from now, please remember to be present, be active, and be educated. Welcome to the wonderful nursing profession. I congratulate each one of you here tonight and wish you the very best in your nursing journey.
Thank you, Mrs. Blanchard. You truly demonstrate excellence and serve as an inspiration to the students for all your contributions to our profession. For tonight's ceremony, the graduates voted on one student to address their respective cohort. It is my great pleasure to introduce to the stage Reina Guevara with the Generic Associates Program and Bobby Hegley with the Career Mobility Program.
Pardon me, y'all, I'm a bit nervous, just a little bit. Good evening. I want to extend my heartfelt thanks to my fellow classmates who sit before you today for allowing me the opportunity to reflect on our nursing school journey together. We possess hearts of gold. To be here tonight is a testament to our resilience. We faced countless challenges, yet continued to fight for what we deserved. We did this for something greater, but we did it for ourselves. The road that brought us here was filled with sunshine, chaotic storms, and the occasional rainbow. Life struggles and losses gripped our hearts. There were days where we didn't just worry, we were worried sick. The reality at times felt crushing and inescapable, yet in our darkest moments, our light was never truly extinguished, was merely overshadowed by self-doubt and imposter syndrome that stemmed from a fear of our own greatness. Think back to orientation, to the first day of class. Remember the endless reviewing of core measures and national patient safety goals. These concepts will continue to be a part of your professional lives. After all this time, we can finally say, we did it. I'm not done. We are now ready to take the NCLEX and begin applying the skills we've acquired. There were moments when everything started to make sense, but our confidence lagged. A day will come when your confidence grows, solidifying every decision you made up to this point. And at that moment, you are going to realize that you are exactly where you belong. I urge you now to give yourself full credit. Your sacrifices, your determination, your unwavering desire carried you through exams, clinicals, finals. There were days when every fiber of your being wanted you to stay under the blankets, but you pushed yourself forward. Even when you were brutally exhausted, you still did your best. On those days, all you needed was to be yourself and breathe. We are adults, parents, students, soon to be professional registered nurses. Underneath it all, you're still someone's child, striving to stay afloat in this life. On your hardest days, show yourself grace. Never be afraid to cry and always fight for justice. Embrace your adventurous spirit and remember that you deserve to take chances. Don't dwell on the rough days, the days where you chose takeout over cooking or sleeping over studying. Even on the gloomiest days, the sunshine was always there. You just had to wait for it. Don't feel guilty about the breakdowns or the constant need to study. The course load was tumultuous, and still you made it to the end. To the friendships we've made along the way, Your presence chased away the dull nature of this chapter and made climbing those stairs to the second floor so much more tolerable. We spent countless hours at the Advocacy Center, in the fishbowl, in the nursing study room in the library. We shared the best conversations, the greatest laughs. We visited Veronica's restaurant until it closed, studied over numerous lunches, and celebrated after finals at Dave & Buster's. Who could forget the trip to the Bulverde lab organized by Scott? We visited the beach, trained together, and built bonds that will last beyond this lifetime. These friendships helped us grow, and our gratitude is immeasurable. Keep these connections alive. Hype each other up, attend conferences, climb the nursing ladder, break the ceiling, then sit and enjoy the view. Without our friends, we'd still be here, but the journey would be less enjoyable. To our spouses, parents, siblings, and all the significant others who supported us, you are worth mentioning. You stood by us, listened to our complaints, and endured this process and the abundance of self-doubt. You took on the last 576 days of instructional learning with us, and though we cannot make up for the time lost or the burden we became, the time ahead is worth embarking on together. Thank you for your unwavering support, the hugs, the reassuring conversations, and the time you gave us. If we had to do it all over again, we choose you to be by our sides. To the fur babies, we hope they sense our gratitude, treat them to something special, take them on a longer walk, secure their feet, keep them safe, or stay on the couch, binge, but give them love. Buy them a new toy and give them the love they deserve. Sorry. To those who cannot be with us today, we wish you were. We know you're watching over us, and we know you'd be proud. Time will prove that you were always there. To our professors, you have helped mold the next generation of professional registered nurses. You provided pearls of wisdom, words of motivation, and more guidance than we thought we needed. You enabled us to acquire the knowledge that has brought us here today. You shook us, instilled confidence in us, and encouraged us to ask questions like why. We knew that some days we were a bit much, but in our defense, being nervous this long has shown us a thing or two. You choose to dedicate your life to educating the next line of nurses, and we owe you a sincere thank you for taking us on. To our babies, our motivation, our everything. I have been asked to convey a heartfelt thank you for your patience and understanding, along with an apology that may never fully suffice. You had no choice in this journey, yet you stood by us during our toughest moments. You watched us level up, and some days you were unfairly put on the back burner. To the older kids who helped with chores and made dinner, or to the little ones who just wanted to play and share every discovery made on YouTube, we're sorry, and we know that's not enough, but know that a lot is about to change. And we hope you never tire of watching us succeed. Continue being amazing, and as you grow, never be too cool to hang out with us. Never stop chasing your dreams, never doubt yourself, and never be afraid to ask why. You are the creator of your own path, and you are destined to shine just as we are today. Know that you are infinitely loved, and the same determination we have, you have too. Finally, I want to share how difficult it was to write this speech. Between studying for finals, finishing virtual assignments, and trying to remember to eat, the hardest part was trying to capture everything. It's impossible to sum it all up. Each of your journeys is worth telling and is full of admiration. We enjoyed some rough times as life passed us by. There was no rhyme or reason for why these things unfolded the way they did, but through it all, we persevered and emerged stronger. I cannot wait to hear and see the stories of who you become. For the first-generation graduates and those who had struggled, will you become a nurse practitioner? For those who love a challenge, will you dive into research? Who will deliver babies? Who will comfort someone in a losing battle? Whatever path you choose, leave a mark of compassion on people's hearts. Hold on to your integrity and never trade your morals for convenience. In a world that is already tough to navigate, continue to look out for those people who cannot help themselves. Be the person who brings peace and hope. Be the person you need to get through this life. Remember to celebrate your journey. You've made it this far. Now relax, rest, and bask in the sunshine of your growth. The little kid inside is proud of who you've become. Thank you.
Good evening, fellow nursing graduates, faculty, staff, and esteemed guests. My name is Bobby Hegley, and I have the privilege of representing my amazing cohort of Mobility Track students this evening. The Mobility Track nursing program here at San Antonio College is a uniquely diverse group of professionals with vast ranges of skills, knowledge, and experience. To be in the program, you must either be a licensed practical nurse or military medic. In our small cohort of just 12 students to start, we had hospital floor nurses, school nurses, pediatric home health nurses, clinic nurses, 4 U.S. military veterans, an active duty Army specialist, a young jet-setting Navy Reserve corpsman, mothers and fathers, a soon-to-be first-time dad, single parents, a military spouse, a storytelling newlywed holding multiple jobs, and at one point, even a chiropractor. Each one of us had to wait patiently and create space in our busy lives to give ourselves the opportunity to go back to school and advance our careers. The Mobility Track students have a unique perspective, knowing well the dedication it takes to provide amazing patient care. This program offered us the opportunity to advance our skill sets and deepen our nursing knowledge, making us more dynamic and capable nurses. There was a quote that I found when preparing for this speech that truly resonated with us as a class and perfectly depicts the nursing student experience. Attending nursing school is a lot like being set on fire, with only late nights and assignments to put you out. We have powered through the confusion, endless nights, never-ending prep use, an undistinguishable amount of ATI assignments, study groups, tiers, long clinical days, and nerve-wracking exams, all while maintaining our families, outside obligations, and for some, their full-time nursing careers. It is difficult to believe that after a very long year, we are here tonight, prepared to finally be penned as graduate nursing students. Before getting to the portion of the speech where we take the time to thank all of the incredible people we love, admire, and respect, it is important for all of us as the nursing students to take a moment to reflect and thank ourselves. To summarize the great Snoop Dogg, who said it best, I want to thank me for believing in me. I want to thank me for doing all this hard work, and I want to thank me for having no days off, and I want to thank me for never quitting. All jokes aside, though, we should show ourselves both grace and appreciation for what we have pushed ourselves to achieve. This incredible accomplishment would not have been possible, though, without the amazing professors who imparted so much of their knowledge, expertise, skills, and patience onto us. Because of you, we will go on and provide the best possible care to our future patients. Most importantly, though, we are forever grateful to our family and friends that pushed us to keep going, even when we wanted to quit on ourselves. Thank you for showing us compassion and understanding when we had to miss family events, and for your patience when we were stressed to the max. Without your unending support, constant encouragement, we would surely not be here tonight. To a segment of people that do not get enough credit, our coworkers, family members, and friends that are already nurses. Thank you for taking our late night calls. Thank you for sitting with us in person or on FaceTime to help us understand different concepts, and for letting us tell you all about our clinical day without violating HIPAA, and for showing us what future nurses we could be if we persevered. Congratulations to all of the nurses being pinned alongside me and my cohort. Let's take all that we have learned and not only crush the NCLEX, but go on to gift our patients with the knowledge, care, and compassion they deserve. Lastly, to the audience, if there is one thing that you take away from tonight, let it be that while there may never be a perfect time to go back to school and pursue your dreams, my cohort of mobility track nursing students is proof that not only can you do it, you should, and it is worth it.
Thank you, Raina and Bobby. We are very proud of you. We will now continue with the pinning of our graduates. Nursing education is a rigorous course of study. The nursing education faculty at San Antonio College is made up of individuals rich in knowledge, experience, love, devotion, and passion. Students were asked to identify a professor that had a significant impact in their learning and role modeled the true meaning of nursing. Their selected faculty member will be pinning our graduates on this special night. At this time, I would like to invite our associate degree graduates forward to the stage to begin our nursing ceremony. I call to the stage Sarah Abreu. Verónica Barcenas. Did she take it? Cassandra Cerda. Angelica Damp. Alani Delgado. Louis Guillen. Vanessa Loredo. Alexis Theriot. I call to the stage Gina Alvarez. Samantha Diaz. Stephanie Henschel. Brianna Limones. Alexis McKnight. Sydney Overman. Laura Sotelo. I call to the stage Yvette Baxter. Rocio Diaz. Megan Hale. Haley Watson. I call to the stage Stephen Felter. Jennifer Baker. Jacqueline Powell.
Okay, goodness gracious. I call to the stage Dr. Daniel Flores. Annalisa Perales. Gina R. Tudor. I call to the stage Mr. Gary Hack.
Victoria Aguillon. Mauricio Alvarez. Gavin Boyle. Bobby Hegley. Torsten Jesowitz. Justin Martin. Jessica Nanias. I call to the stage Dr. Marjorie Leek. Brianna Carrion. Crystal Nogues. I call to the stage Pamela Mann. Camila Manriquez. Caitlin Matthey. Adriana Weaver. Emily Matthews to the stage, please. Furaha Nidabukara. Lindsay Bright. I call to the stage Dr. Edward Miranda. Rose Sagar. I call to the stage Dion Morin. April Reyna. Michael Robideau. Andrew Smith. Yanet Valles. I call Ernest Perez to the stage. Kimberly Cox. John Navarro. I call Rebecca Plemper to the stage. Arwin Blanchard. I call Irene Rios to the stage. Fernando Abarca. Dalia Daly. Reina Guevara. Natalie Magallanes. Angela Okendo. At this time, I would like Dr. Eve Rodriguez, the Executive Director for the Bachelor of Science Bridge Program, to come forward.
Oh, they told us not to do that. Okay. Tonight is a very special night for our BSN graduates who have worked tirelessly to fulfill their degree requirements while being employed full-time at various hospitals throughout our community. This is our third cohort of what started in 2021 of fall with 21 students and has grown significantly over time. We are extremely proud of their work and honored to stand beside them on their journey. The BSN faculty will now be presenting a special stole to symbolize the successful completion of the program and advancement of your nursing career.
It is my pleasure to invite Dr. Mary Horton and Dr. Russell Zients, our BSN faculty, to present the stoles in recognition of our BSN graduates. Michael Valentin Afana. Alma Alvarado. Morgan Blum. Beatriz Adriana Ramirez de Guia was unable to attend. Oh, okay, she's here. Okay. Raúl Escamilla. María Gabriela Farias. Maria was unable to attend. Corinne Fongang. Unable to attend. Brianna Sherelle Fuller. Jorge Galacia. Phoebe Gonzalez. Michael Elias Hernandez. Jessica Ann Ibarra. Unable to attend. Yvonne Grace Juarez. Jamie Marie Martinez. Gorpu Guma. Christine Galamug O'Brien. Karen Perovich. Natalie Sosa. Emeline Valdivia. Ladies and gentlemen, it's time to celebrate the lighting of the lamps. As our final graduates return to their seats, I will ask the audience members who are nurses to stand with us. I will ask our faculty to stand with us and recite the pledge. Graduates, please stand at your seat and light your lamp. We ask you to affirm or reaffirm your commitment and pledge to serve the community and healthcare. I invite all nursing faculty and all the audience who are registered nurses to join the graduating class of 2024 in reciting the International Council of Nurses Pledge. This pledge can be found in the back of your program. Graduates, repeat after me. In full knowledge of the obligations I am undertaking, I promise to care for the sick with all the skills and understanding I possess. Without regard to race, creed, color, politics, or social status, sparing no effort to conserve life, to alleviate suffering and to promote health. I will respect at all times the dignity and religious beliefs of the patients under my care. Holding in confidence all personal information entrusted to me. And refraining from any action that might endanger life or health. I will endeavor to keep my professional knowledge and skill at the highest level and to give loyal support and cooperation to all members of the health team. I will do my utmost to honor the International Code of Nursing Ethics and to uphold the integrity of the professional nurse. Thank you. Ladies and gentlemen, it is with great pride that I present to you the San Antonio College Department of Nursing Education's graduating summer class of August 2024. We ask as the graduates process out of the sanctuary, we ask that all guests please meet your graduates outside of the Summit Christian Center for photos and congratulations. We thank you for your time and attention tonight.